Healthcare is a constant hot-button topic in the national news cycle, and the Southfield Kappa Alpha Psi fraternity recently held a healthcare panel to discourse about it. The Southfield Public Schools Administration Building was a site for an informative yet spirited discussion on healthcare and healthcare reform.
Healthcare is at the forefront of every level of government and in people's lives. It is important that people know what initiatives are out there for them, even at the local level from the city to the county. Our county has now expanded some of the programs that are in our community health, going in and allowing citizens to come in and get nursing help. There's nurse on call. We're available at any time at the county that if a person has a question about a health, be it in nutrition, diet, some of the silent killers, we have people there that's available and ready to help them with it.
Held on the observance of the passage of the healthcare reform bill, the panel was comprised of professionals from numerous fields who had various reasons for participating, but who all shared a common desire to educate the community.
I think that I have something to offer and share on the panel today because I come at healthcare from a couple different perspectives. So, I'm a person, a woman with a family, so I have physicians that I see, that my children see, so I'm a patient. I'm also a physician. I deliver healthcare every day in private practice. I'm a business person, so I also have to pay for healthcare for myself, for people in my family, etc. And also, I serve on the board of an insurance company, so I can take a look at healthcare from the insurance company side. And also, I teach residents who come in through the office, so as an educator and someone who is a participant in the healthcare system. So I'm on staff at St. John Hospital, I'm within the DMC system at Sinai Grace, I'm on staff at Beaumont, Grosse Pointe. So I'm also within the larger healthcare provider system.
I was asked to come to the community to basically give general information about healthcare reform, what it means to them, what the timeline is on the healthcare reform bill, and the overall community impact and the benefit of this bill to the public. And so I think that it was predominantly educational. It allowed the community to ask questions regarding the act, especially how it will individually impact them given their individual situation. And so I think the panel was excellent and we were able to provide that information.
Viewed by all accounts as a success, panelists hope that audience members walked away with information that could be easily applied.
I think the one thing I would hope is that the purpose of this legislation is to try to expand access to affordable health insurance for the public. So we wanted to make sure people understood, based on their current situation, what's the process for you to be, especially if you don't have health insurance, how do you obtain health insurance? How do you engage and how does this law benefit you? And how can you yourself use the information to go out for your family and provide health insurance protection? So I think that's what we attempted to do to make sure that we gave basic information on basic timelines and basic content of the Affordable Care Act.
I hope that the participants today learn some new things about how the healthcare systems are evolving. But I also hope that they take away a sense of excitement about the change, because even though change is difficult, I'm very excited. I'm excited that we can try to really manage costs over time, and by doing so, we also really make our healthcare systems better. We deliver better healthcare, our patients are well taken care of, and we still do it in a way that is best for our society, for our community, for our country, by making sure we have health care for all, because we can really afford to give that health care to everyone, not just to a select few.
Oh, two things. Number one, how important your health is. You only have one life. And making sure you know what are the things to look out for and the things that you need to do to keep yourself healthy. And then secondly, and that people know where to find health care when they need it. There are a number of services available. At the county we have prescription drug that can supplement or be a service to people. We have various health professionals there that, again, that can be a help to constituents. So the takeaway is remembering how important your health is, and secondly, remembering that there are services out there available to the constituents.
To learn about various events presented by the Southfield Kappa Alpha Psi fraternity, visit southfieldkapsi.com.